chronic diseases, cancer has a multifactorial etiology. 1. Environmental factors. Environmental factors are generally held responsible for 80 to 90% of all human cancers. The major environmental factors identified so far include tobacco in various forms of its usage. For example, smoking, chewing, is the major environmental cause of cancers of the lung, larynx, mouth, pharynx, esophagus, bladder, pancreas and probably kidney. It has been estimated that, in the world as a whole, cigarette smoking is now responsible for more than 1 million premature deaths each year. Alcohol. Excessive intake of alcoholic beverages is associated with esophageal and liver cancer. Dietary factors. Dietary factors are also related to cancer. Smoked fish is related to stomach cancer, dietary fiber to intestinal cancer, beef consumption to bowel cancer, and a high-fat diet to breast cancer. Occupational exposures. These include exposure to benzene, arsenic, cadmium, chromium, vinyl chloride, asbestos, polycyclic hydrocarbons, etc. Many others remain to be identified. The risk of occupational exposure is considerably increased if the individuals also smoke cigarettes. Viruses. An intensive search for a viral origin of human cancers revealed that hepatitis B and C virus is causally related to hepatocellular carcinoma. Parasites. Parasitic infections may also increase the risk of cancer, as for example, schistosomiasis in Middle East producing carcinoma of the bladder. Customs, habits and lifestyles. To the above causes must be added customs, habits and lifestyles of people which may be associated with an increased risk for certain cancers. The familiar examples are the demonstrated association between smoking and lung cancer, tobacco and betel chewing and oral cancer, etc. Others. There are numerous other environmental factors such as sunlight, radiation, air and water pollution, medications, for example, estrogen, and pesticides which are related to cancer. 2. Genetic factors. Genetic influences have long been suspected. For example, retinoblastoma occurs in children of the same parent. Mongols are more likely to develop cancer, leukemia, than normal children. However, genetic factors are less conspicuous and more difficult to identify. There is probably a complex interrelationship between hereditary susceptibility and environmental carcinogenic stimuli in the causation of a number of cancers.